Pediatric dose calculations. To calculate pediatric dose, we need to check on the three things. First is patient's weight. Second is the drug dosage. Third is the presentation of the drug, whether it is available in tablet format or injection format, drops or syrup format. Next, we will see the administration part, whether it has to be administered once in a day or in divided doses, like for example, paracetamol is given once every 6 hours. That is 10 to 15 milligrams per kilogram of body weight of the dose is given every 6 hours. Next, if we see there are few medications which should be given once in a day, for example, Cefixin 8 milligrams per kilogram per day. Next, if we see the formulas, we have 3 different formulas. First one is Young's formula, where the child dose is calculated by age in years multiplied by adult dose, which is then divided by age plus 12. Second formula is Fried's formula, where the child dose is calculated by age in months multiplied by adult dose divided by 150. Third is Dieling's formula, where the child dose is calculated by age in years multiplied by adult dose, which is divided by 20. Of these 3 formulas, the most commonly used formula is Young's formula. Here are a few equations which need to be memorized. Let's begin. Total dose is calculated by weight of the patient in kilograms multiplied by the dose of the drug. How to find out the milliliter to be administered? It is calculated by the total medication dose given divided by milligram of presentation, which is multiplied by milliliter of presentation third one, if the medicine has to be given in the form of drops, and if the calculated dose is as small as 0.8 milliliters, then we will multiply it by 20. As we know, 1 milliliter is equal to 20 drops. Multiplying 0.8 milliliters into 20 gives us the amount to be administered. Fourth one is if the drug has to be administered in the pill form, then the formula is total dose divided by the concentration of pills. Next is for reconstitution. The drug concentration is equal to the presentation of the drug divided by amount of milliliters for reconstitution. For example, the concentration of the drug is 12 lakh units, and if it has to be divided by the amount of ml for reconstitution, that is 5 ml, then the drug in 1 ml we get after calculation is 240,000 units. Formula to calculate pediatric dose based on the milligram administered, which is equal to the medication dose administered in milligrams divided by weight in kilograms. Step 1 is milligram administered, which is calculated by milliliter of presentation multiplied by milligram of presentation. Step 2 is medication dose, which is calculated by milligram administered, which is divided by weight in kilograms. All these formula need to be memorized for us to further understand the dose calculations. Let us now understand with the examples. Paracetamol. Paracetamol is given as 10 to 15 milligrams per kilogram of the dose. Step 1 is to calculate the medication to be administered, which is weight of the patient in kilograms multiplied by dose of the drug. For example, the weight of the patient is 12 kilograms, then this multiplied by the dose of the drug we get is 180 milligrams. Now step 2 is, if we have to give this in the syrup form, then the concentration in milliliters of the drug is to be known. Each 5 milliliters of syrup of paracetamol has 120 milligrams of the drug. Step 3 is to understand the milliliters to be administered. Total medication dose divided by milligrams of presentation into milliliters of presentation. After putting all the values and after calculating, we get 7.5 milliliters. Thus, paracetamol, we have to give 7.5 milliliters once in every 4 to 6 hours. Amoxicillin. Amoxicillin is given as 80 milligrams per kilogram per day divided in 8 to 12 hours. Step 1 is to calculate the medication to be administered, which is weight of the patient in kilograms multiplied by dose of the drug. For example, the weight of the patient is 12 kilograms, then this multiplied by the dose of the drug we get is 960 milligrams. Now step 2 is, if we have to give this in the syrup form, then the concentration in milliliters of the drug is to be known. Each 5 milliliters of syrup of amoxicillin has 250 milligrams of the drug. Step 3 is to understand the milliliters to be administered. Total medication dose divided by milligrams of presentation into milliliters of presentation. After putting all the values and after calculating, we get 19.2 milliliters. Step 4 is the total dose has to be divided in 8 to 12 hours. Thus, we give 6.4 milliliters once in every 8 hours. Dose calculation in special situations, for example, if there is combination of medicine like trimethoprim and sulfamethoxazole, we give this as 8 milligrams per kilogram per day divided in 12 hours. Step 1 is if 12 kilograms is multiplied by 8 milligrams, we get 96 milligrams. Step 2 is if we have 40 milligrams of trimethoprim and 200 milligrams of sulfamethoxazole in 5 milliliters, then to calculate we always use trimethoprim dose. Step 3 is milliliters to be administered, which is 96 milligrams divided by 40 milligrams into 5 milliliters, which is equal to 12 milliliters. Step 4. If this has to be given once every 12 hourly, then it is divided by 2, where we get 6 milliliters. Thus we give 6 milliliters once in every 12 hours. Next example is calculating the dose of the drug in drops. For example, if we have to give C-Fixim, which is 8 milligrams per kilogram per day, then 1 milliliter of syrup C-Fixim has 100 milligrams. For example, if the child's weight is 10 kilograms, step 1 is 10 kilograms multiplied by 8 milligrams, we get 80 milligrams. Step 2 is milliliters to be administered. After putting the values in the formula, we get 0.8 milliliters. Step 3, as it is very impractical to give 0.8 milliliters, we prefer to give it in drops. Now we know 1 milliliter is 20 drops. Multiplying 0.8 into 20, we get 16 drops. Thus, we give 16 drops once daily.